though we seldom hear about HIV in the U.S. anymore, HIV is still killing women, children, and their family members in the developing world. More than 70,000 women and girls over the age of 15 are living with AIDS in Mali, West Africa. Mali has nearly 6,000 new HIV infections every year and an equal number of AIDS-related deaths. Women and children are mostly affected by this disease. No mother wants their child to be born with HIV, and yet nearly 2,000 children are born with HIV in Mali every year due to mother-to-child transmission. And even though HIV testing and treatment is well accepted and available in other parts of the world, this testing and prevention treatment is not available to all mothers with HIV in Mali. In fact, only 1 in 3 mothers living with HIV are on treatment to prevent transmission to their children. One reason for lack of access to HIV prevention is stigma. If a Malian woman is discovered to be HIV positive, she may lose her home and her child as well. HIV-infected children are also stigmatized. Children who have lost one or both parents to AIDS have difficulty finding safe housing and adequate food. Dr. Annie de Groot, the founder and scientific director of GAIA Vaccine Foundation, has been traveling to Mali since 2005 to establish and work with a wonderful team of physicians, nurses, midwives, and community health workers that provide HIV care. In 2008, GAIA made a decision to focus on demonstration projects based at a local clinic that was built in Sikoro, Mali, with the generous support of a donor from Providence. The name of the clinic is Chez Rosalie. The first program developed in that clinic was for mother-to-child transmission prevention. Since then, GAIA has helped to build more examination rooms, laboratory facilities, and has trained physicians to provide HIV care at the clinic. GAIA helped to develop and support programs such as free HIV screening, free HIV treatment, tuberculosis screening, teen peer education, and a nutrition program where meals are prepared by HIV-positive women and shared with their families. In 2015 and again in 2018, GAIA obtained further funding from the Bill and Melinda Gates Foundation and Merck Pharmaceuticals to support another large program to promote cervical cancer screening and HPV vaccination for the prevention of cervical cancer among women and girls. This program included training for medical staff and education for healthcare workers in the community. Because only 22% of women in Mali are literate, the preferred method of education is storytelling through textiles. The storytelling cloth uses vibrant textiles to promote testing and treatment. Because of this method of teaching, cervical cancer screening increased 5-fold in the participating clinics. GAIA's next campaign is called Women and Families Well-Being. This campaign will again use specially designed West African textiles in peer-to-peer education sessions to empower Malian women and their families to help reduce HIV transmission and the stigma of HIV/AIDS. Our outreach programs address the family as a unit, using education during prenatal visits and activities known as grains that take place outside the clinic on weekends. On these occasions, women and men gather together to plan and execute community projects. By encouraging individuals to get tested and treated early, access to care and reduced HIV/AIDS will also improve. GAIA's long-term goal remains to promote the development of globally relevant and globally accessible vaccines that can be distributed in the developing world on a not-for-profit basis. GAIA Vaccine Foundation activities are centered on 4 themes: education, prevention, access to care, and vaccination. We want to make a meaningful difference for the women and girls in Mali. Please join us. Together, we can make a meaningful difference for women and girls in West Africa.